it's not as pleasant an environment to work in anymore.
Heart attacks or COVID-19? Which do you think places a greater demand on a hospital's ICU in terms of cost and resources? A new study is focusing on just how much COVID-19 is costing our healthcare system, as the virus has ICU units across BC reaching their limits, and doctors report severe staff burnout on the front lines. The Canadian Institute for Health Information says costs could climb to about $50,000 for a COVID-19 patient in ICU, compared to $8,400 for someone who had a heart attack.
And not like a typical heart attack patient, where things are usually made up one way or the other in less than a week.
The report covers data between January 2020 to March 2021.
That kind of piqued my interest.
Meanwhile, Dr. Gerald DeRosa of Royal Columbian Hospital says the ICUs at Abbotsford, Surrey, and RCH are on their way to hitting capacity as more staff is being pulled in to help those units cope. Others are being forced to bear the brunt.
The worse it gets, the more stress it's going to put on the system, the more it's going to decrease other medical activities. And I think the concern that I have mainly is the more stress it's going to place on the system and the people providing the care. You know, we've been fighting COVID now for more than a year and a half.
DeRosa says that has workers moving away from frontline positions, some even retiring early.
Do overtime shifts and then just getting tired, and then the lack of vacations and travel and everything. And, I think that also has a role to play. There are easier jobs to do than work in an acute care hospital.
In places like the interior, we're seeing hundreds of surgeries being canceled or delayed. And even though we call these surgeries non-urgent or non-emergency, they're anything but not important. These are still important surgeries. These are often cancer patients, for example, that are seeing their treatment delayed because of this. And our healthcare workers, after 18 months, don't have much more gas left in the tank.
The province reported Thursday out of 130 patients in ICU, 111 are unvaccinated. And doctors say that's obvious at the hospital.
You look in someone's face and they're getting sick or they need to get intubated, and you hear them say, I just wish I would have listened and got vaccinated, or their family members are saying, it's just heartbreaking to see.
In Vancouver, Crystal Adaris, City News.